septum. Okay, it's a dividing wall between the two sides, and it's crooked into the right side, blocking that off. That's been that way for a long time. Here's the comparison, nice and open on the left side. Okay, but the main thing we're worried about is the larynx, and so here we are looking at the vocal, looking at the larynx. Okay. Let me show you. Back up a little bit so I get a better view.
Start low.
So that when you talk, the vocal cords come together. When you breathe, they open up. Okay. I had a nice global view as I was looking at it at one point. So. Okay, that's pretty good here.
Big sniff. Sniff. Good. Sniff between. Sniff. Good. Good. Now just breathe easy for me. Now, I want you to do this. Go.
Okay, now we're going to. Okay, so this side's a whole lot more normal. Okay, on this side. So you can see this is the arytenoid cartilage. This is the aryepiglottic fold here. This is the false vocal fold, and then up here is the epiglottis. This is called the piriform sinus. All that looks pretty normal on your left side. Okay. On your right side, you got this big honking thing in here, and then you've got, as we get closer to it,
Is this supposed to look like that?
it is. It's supposed to be a mirror image of it, okay? As we get closer to it, you see you've got this swelling, irregular swelling. This is the left true vocal cord, the vocal cord you're supposed to talk from, and this is the right one here, and they don't look the same. When we switch to a slightly different color of light, you can see there's a bunch of stuff on this one too still, whereas this side looks pretty normal. So I must say, I am still quite concerned that you might have a cancer, okay? Because it is still quite irregular. There must be more than one thing going on. You do have what's called that laryngocele, where there's apparently air kind of trapped inside, and that's what's making this look so full right here, okay? Because that's swollen up in there, and that is air and maybe some fluid that's in there, okay? That's kind of trapped in there. That's what's making that big. But what's causing the air to be trapped is the more concerning thing, okay? So we are gonna schedule you for a surgery, but we're gonna schedule you first for just a. How old are you again?
84.
84. So we're gonna schedule you for a decompression of that. Okay. So I'm not gonna take the whole thing out this time. Okay. And I want to decompress it so we can kind of figure out what, make some more space in there, see if the pressure from that pocket is contributing to your hoarseness, and then also have a really good look at the true vocal cords and stuff. Okay, so it's possible that there's a little tumor kind of up in the little valley right here that's blocking the opening to that gland I was talking about. Okay. And that, from your previous smoking history, that could have happened, or something else maybe just plugged up the duct. But the right vocal cord looks irregular, and if it's just a saccular cyst, and like, so sometimes people get that cyst and it presses on the vocal cord much like somebody putting their finger on a guitar string, not on the fret, and it changes. It just dampens the vibration, and people sound terrible. But the vocal folds look normal. Okay, your right vocal cord does not look normal either. Okay, so we're going to get you on the schedule to go back for a biopsy and drain that cyst. I'll use a laser. We'll make a cut into that area and let the air or fluid out of it. At 85, I don't think, 84, 85, I don't think I want to do the whole thing necessarily. We may be able to get a long bit of symptomatic relief with less risk and recovery time by just draining it. If you were 55, I'd say we could take it out, okay? But you're 85, and so I don't know if we need to do that big of a surgery for you, okay? And then we'll do some new biopsies and some other stuff and see if we can make that better as well, okay? Now, we at our voice center, we call ourselves the Greenville Voice Center with Greenville ENT, and we have speech pathologists who help with rehabilitation, okay? So after surgery, I don't think that we really need to do that much before surgery. Maybe one visit just to sort of say, here's what to expect after surgery and stuff like that. But after surgery, I'd like to see them some to help kind of, like if you had a knee surgery, you would see physical therapy for that, right? You would do that after surgery. So it's the same kind of thing. Our speech pathologists are therapists for the throat with swallowing and voicing, okay? And I think that may be helpful, but not before surgery, okay?
So exactly.
He's on that.
For the image maker, when you operate, what are you going to remove?
I'm going to make an incision right about here, okay? And I'm going to drain the contents of that, okay? Which will help to decompress this area, let me see what's going on better in this area, and we're going to do some biopsying of this area here, of all this. What is this stuff? You know, we got to figure out what that is. Now the amyloid is one thing. It kind of has an appearance of amyloid, and that's a deposition where the body deposits this proteinaceous mix called amyloid, and that looks similar to that. They did not call that on the previous one, but they did also not do the right stains for it. So, okay.
Dad, you had a question? He's pointing.
Are they calluses?
Calluses? No.
Color.
Color?
The color.
The color.
Okay. Is that accurate?
No, that is a special light that shows some
It just shows
other
you.
features of the tissue.
Yeah.
This is the natural color. There. Okay.
Yeah, it's just so he can see different
But it should
things.
look like this. Okay, upside down. That screen is upside down from this picture, but it should look like that.
Okay.
And it doesn't look anything like that. Okay.
Yeah. What are you saying? If it is the cancer part, that would be in that part that you're going to cut open?
No, it's probably below that.
Below
Probably
that.
in the stuff that's in the center of the screen, kind of into the screen that we want to do. Do you have, you're on Eliquis, what are you on that for? What do you take Eliquis for?
Fibrillation.
Okay. And you can stop that? The doctor said you can stop that for surgery? And do you have a pacemaker?
I don't.
I would expect this to be outpatient surgery. You don't use oxygen at home or anything, right?
No.
Did Dr. Rivera look in your esophagus while she was there before?
She did.
Okay. It's hot in here.
Very.
I'd like him to see speech once before surgery.
Okay. Speech therapy is in this building, but on the top floor. Bill's room.
I'm getting to the age where potentially I'm concerned about that.
Yeah, I understand that.
And because of
What's that last part?
I want to wake up.
We want you to wake up too. I've never had anybody not wake up.
So his anesthesia kind of looks badly on him. Don't wake somebody up.
Okay, let me just fill out your checkout sheet and then we'll get you rolling.